Hello, and welcome to the presentation regarding my capstone project for the Masters of Science in Nursing with a concentration in Leadership and Management. The capstone project is titled Nursing Process Change to Deliver Consistent Patient Chemotherapy Education, presented as a part of a degree fulfillment requirement at Western Governors University. My name is Ryan Minix, and my background for oncology started about 8 years ago when I started as a nursing assistant on the oncology unit. During that time, I attended school for my undergraduate degree in nursing. I completed that degree in 2012, and I've been a nurse now for about 3 years in oncology. I have fallen in love with it, and it's my passion, which is what has driven me to want to make positive changes for our unit with this project. The project was developed in response to some concerns that this student had observed related to our patient education process for chemotherapy teaching. Patients that are receiving chemotherapy are at increased risk for life-threatening side effects, including neutropenias, which is probably the most severe. Sepsis can progress rapidly in these patients, so it's important that they understand when to report and how to report their side effects, such as fever, as well as other side effects that they need to manage at home to help prevent complications from nausea or diarrhea. The patients have a right to be fully informed about their treatment plans and options. We also found that patients weren't aware of what to expect during their treatment. This information was brought about by observation from this student, as well as feedback from our unit manager, our HCAP scores, and feedback from the medical oncologist. The nursing process for chemotherapy education with patients, there was no formal process that existed. So this project developed a nursing process for the education of patients related to chemotherapy. It was implemented at Curling-Roanoke Memorial Hospital on the oncology unit. The oncology unit is a 22-bed unit that also services inpatients as well as outpatients. The Curling-Roanoke Memorial Hospital is an 800-bed facility, a level 1 trauma center in Southwest Virginia. The oncology unit had a mixture of experience levels. The large chunk of our people had 5 years or less experience, and a surprisingly large chunk of people had 2 or less years of experience. The percentages are that we had 31% of our staff had 2 years or less experience, and anyone who had 3 to 5 years experience was about 50% of our staff, and then our most senior members with the experience and knowledge in oncology for 5 years or more was at 19%. So a relatively low percentage for for our more seasoned nurses. That, coupled with our HCAP scores and our underperformance and documentation of chemotherapy education, is what prompted this project. With having a reduced amount of experience in oncology, there is obviously a lack of confidence that comes with that knowledge level and experience level. So we were hoping that through this project, not only would we standardize our chemotherapy education, but we would also increase the confidence of our nurses who had less experience in oncology. Our documentation percentage for documenting our patient education as completed with understanding by our patients was at 89%. Our goal for the unit is to be at 100% because it is such an important aspect for our patients to understand their chemo treatment and the side effects, what to report, and how to manage their side effects at home. Our HCAP scores, key drivers in Nurses Explain, was at 89.47%, and our Nurses Explain medication side effects were at 70%. The concern with this is that our unit target is 93% for these items, and our HCAP scores are indicating that patients don't feel that they are being educated about these topics, and that nurses aren't explaining their treatments well. all of these things coupled together is what prompted the Capstone project. So specifically, we identified the following gaps in our practice, which was there is no formal education process for educating patients. There was no formal education process for educating nurses on how to educate patients. So we weren't teaching them how to teach. The other thing was that we were only incorporating a single modality for teaching. Most of the time when education was occurring, they were either just given handouts or there would be a nurse discussion. On occasion, there would be a nurse discussion with these handouts provided, but there was no standard method of presenting this education to patients, and most of the time, nurses were only utilizing a single modality approach for the education they were providing to patients. Prior to our project implementation, our process was, as I said before, pretty much non-existent. So the nurses would have a discussion with the patient, and some nurses, like I said, used handouts. They were not utilizing the teach-back method or video education, even though we had implemented recently an interactive patient education system at Carilion Memorial Hospital, where their TVs are linked to health information, as well as there were education videos that could be assigned to patients to watch to help facilitate the education. These things were not being used, so that was prior to our process implementation. There was a wealth of information regarding effective patient teaching methods. The most common theme throughout the literature was that a multimodality approach to patient education was more effective. So utilizing more than one method, according to research, helps patients retain information, feel empowered to be able to care for themselves in the absence of a healthcare provider, immediately instructing them on how to care for themselves. Another thing that was noted in the literature was that video education, coupled with other methods of education, was found to be more effective for patients, and also the fact that patients, if they're able to rewatch video education, are able to pick up on things that they may have missed the first time around watching the video. Another method that was highly effective in confirming patient understanding was the teach-back method. So this caused patients to have to engage with healthcare providers, listen attentively, and be able to read back or teach back what they had heard or understood the healthcare provider to communicate to them. This allowed the healthcare provider to assess at that moment the understanding that the patient had of the information taught, and then if there were any knowledge deficits according to the teach back, the healthcare provider at that time had an opportunity to fill in the hole or the deficit with the knowledge that they were lacking. The first steps to this project were to obtain approvals and develop a sense of urgency with nursing leadership, which, according to our HCAP scores, our senior nursing leadership was already concerned that we were under target, and with the anecdotal feedback from our medical oncologist that patients weren't reporting side effects in a timely fashion, or weren't reporting at all, and they were being discovered incidentally, was of great concern to us. So that prompted us to form an interprofessional team of the student, our unit nurse director, our nurse educator, our mid-level provider, and our medical oncology director. This team came together to formulate a plan based on the research that the student was able to develop or find during this project. The project was then formulated into a checklist. We felt that the checklist method allowed for nurses to move in a standard fashion through required topics to educate. Also helped that if the nurse needed to step away for a moment, there was a stopping point on the checklist that another healthcare provider or another nurse could pick up where that nurse left off and continue the education. We used, with this checklist, when we developed it, we decided to make sure that there were references available to materials that we would be providing patients with. So our checklist included information about which chemo education video on the interactive system covered that topic, and our unit uses the Chemotherapy in You book developed by the National Cancer Institute. We have references to that so that we could easily use that book to go through and highlight important things for them, as well as give them a quick glance at where these options, this information was available in the Chemo in You book. We utilized the train the trainer method for part of our training. This helped facilitate that this student wasn't doing the entire training for all 54 staff members. We were able to bring on 2 other people. We called them chemo education champions. They were trained by me extensively and prepared to educate the staff. Once that was done, we took the unit roster of the 54 nurses that we have and divided it among the 3 of us to ensure that we could rapidly and effectively educate all of the nurses on our unit in a short time period. We were actually able to train about 95% of the staff in over 2 weeks time, which helped us to be able to launch this project much faster than if I was responsible for training solely by myself. Some successes about our implementation for our project was that we had increased communication, which is always good in the healthcare environment, to make sure that physicians, mid-level providers, senior leadership, then the staff nurses are on the same page, that we're educating patients how they need to be educated, how their medical oncologists want them to be educated. This process demonstrated a commitment to the lifelong learning, which is important for every nurse to continue to learn and be ready to adapt to the changing healthcare environment. I'm proud to say that my unit did a very great job of accepting this change readily, being eager to train and adapt this new process. And the common goal of improving patient education was definitely in the forefront of all of our staff nurses' minds, as well as the interprofessional team that helped implement this project. Patient education, as I discussed before, was important to make sure that our patients understood what to expect during their treatment, what type of side effects that they could potentially experience, how to manage those side effects at home, and when those side effects need to be reported to the provider, and what kind of time frame that they need to be reported in. The last thing that we were hoping to accomplish with this project was increase staff confidence. Many staff have reported feeling more confident in their ability to educate patients and to actually know what they needed to teach. They had an idea of topics that were important for our patients, but they didn't have a guide to show them what exactly needed to be taught to patients and in what order. So many staff members have said that using this checklist has helped them to be able to successfully communicate in an organized fashion with their patients. Some aspects that did not go as well as we had hoped with the Capstone experience. There was a significant delay in establishing approval for this project. Apparently, at the beginning of this, when the student submitted for authorization to function as a student at this facility, they required additional agreements to be established between Carilion Memorial Hospital and Western Governors University. This resulted in several phone calls and quite a lengthy delay in getting these approvals. Sometimes I think at bigger institutions it may take a little while to get the wheels rolling. It took approximately 12 to 14 weeks for us to be able to obtain final approval for me to then approach my mentor to see if they'd be willing to sponsor me as a student and work with me on this project. The other aspect that didn't go well with this project was that staff training was not uninterrupted as we'd hoped it had been. The goal was that staff, if they had an assignment during the time they'd be trained, that assignment would be covered to minimize interruptions and hopefully eliminate them. Unfortunately, there were a few staff members that had to be trained in the middle of their shift due to time constraints and scheduling allowance. which unfortunately, since they were that patient's primary nurse, there was interruptions that the nurse covering didn't feel that they could handle without getting feedback from the primary nurse. So those sessions were frequently interrupted. One thing we did do to minimize those interruptions on staff that had to be educated during a scheduled shift with a patient assignment was to do this first thing in the morning so that our charge nurse could cover their patients first thing in the morning to get the education done right after they received report. This did help minimize the interruptions to the remaining staff that needed to be trained during their shift. The impact for future projects will be that it'll be helpful to establish a contact person for potential issues with establishing agreements. In the future, this student wasn't aware of who my specific contact person would be at Carillion Clinic or Western Governors University. So in the future, when I'm headed into a project like this, I would like to obtain this contact information to be able to ensure that my communications are directed to the right person in a timely fashion to help facilitate on-time completion of projects. The other part that can impact future projects will be that it's important to assign nurses education time outside of a regularly scheduled shift. So if that means that we do this after their shift is completed at the end of assignment, or at the beginning prior to accepting an assignment, or during a time period where they have no other obligations. Patient care comes first, of course, and so unfortunately that was an interruption to some of the training that we had, but that will be a way to minimize that in the future, is to make sure that it's scheduled on a day they don't have an assignment, or to make sure that it's done at the beginning or the end of their day. So our organizational support that will be required in the short term to maintain this project will be to facilitate uninterrupted training of the remaining staff on our unit that have not completed this training. They will also need to randomly audit charts to ensure that documentation of this education is being completed, as well as the chemo education checklist is being completed. The clinical team leaders on this unit routinely audit for chemotherapy patient education documentation anyways, so this will just be one more point for them to be checking during these routine audits. We would like to solicit staff feedback. We're hoping to, at the 3-month mark, be able to survey staff for their thoughts and feelings on how well this is working, or what things need to be improved, or if there's topics that are missing that they feel need to be covered for patient education. Another thing that we're hoping to continue to keep in the forefront of our staff's mind is they will be emailing updates of the impact of our new process. So every month when we get an updated HCAP scores report, we'll be able to provide them information about how our patients feel we're doing, and related to Nurses Explain, as well as medication side effects. Hopefully we'll see an improvement of these topics as we continue to improve our process that we educate our patients with. And then they will need to, as we're identifying staff that are not following the new process, they'll need to have individual follow-up with those staff nurses to ensure that they understand the project, why it's important, and how it actually functions. And if they understand but are choosing not to do this, then they'll need to be followed up with by nursing leadership to determine an appropriate course of action. A lot of times it could just be a misunderstanding or a lack of knowledge, in which case we'll be able to quickly rectify that problem by re-explaining the process and ensuring that they understand why it's important and what the expectation is. Like I said previously, there'll be a project reevaluation at 3 months with the interprofessional team to review our HCAP scores, our nursing feedback, and any anecdotal information that the medical oncologists have to provide about how they feel the patients are managing their side effects, or how they're reporting them in a timely fashion. those things will be taken into consideration, and there may need to be some adjustments to this process made. But hopefully we're seeing a positive impact from this process change. Long term, for organizational support, as I said, we'll review the nurse feedback and the HCAP scores and make the revisions on this. Once we feel that we've reached a point that the process is working well and the desired outcomes are being achieved, we'll need to have a more formal unit policy finalized to have a reference for staff to follow, as well as hold staff accountable to. And that'll be finalized after we get those other evaluations done. For the long term, they will continue to chart audits and individual follow-up for staff that aren't performing to the standard expected. The post-implementation support resources for this project include making sure that this is a part of our annual education for staff, and ensuring that the annual competency validations include utilizing the appropriate methods for educating patients, as well as an understanding of the teach-back method and how effective a multimodality approach is to patient education. There'll need to be obviously some funds allocated for training of new staff, as well as our refresher courses that we do every year for the annual education. There'll need to be some education time allotted in the funds for that. Also, there will need to be ongoing monitoring. As discussed before, we'll incorporate chart audits as well as individual follow-up with staff that are underperforming. And this will hopefully continue the success of this project by utilizing the support resources. There's two program outcomes that we'd like to discuss and how this project helped us meet them. So the MSN program outcome for constructs an interprofessional team. They had a common goal of improving patient care through ensuring that our patients are well educated, and also by increasing our communication. This project forced the nursing staff and the medical oncologists, the mid-level providers, senior nursing leadership to come to the table and talk about what was important on each side and how we felt that we could benefit the patient by utilizing a new process based on evidence-based practice. I'm happy to say that our team successfully achieved this through this project, and hopefully we'll see a positive impact in the outcome in the months to come as we're evaluating the ongoing process of this project. The second program outcome is integration of technology to manage care. The staff had been using some antiquated methods for patient education. The main thing is using old handouts and the nurse discussion. While nurse discussion is important and will never be replaced solely by any other method, it needs to be coupled with other pieces or other methods of patient education. And as we discussed before, it's important to incorporate a multimodality approach to increase the effectiveness of our patient education. The staff was able to increase the utilization of the technology that the hospital has implemented already, the interactive patient care education system that's built into every TV. And it's now been integrated with our electronic medical record system, so that at the click of a button, a nurse can choose the videos they want to assign for the patient to watch, sign that, and as soon as it drops into the patient's chart, it drops to the patient's televisions, actually giving them a visual prompt on the screen that the nurse has assigned them some important education videos. We are getting the nurses to regularly, as they're in the rooms, check to see if the patient has assigned education, and encourage the patient to watch those education videos. For our chemotherapy education, it's shown that patients' feedback so far has been very positive, that they feel like if there's something that they missed or misunderstood, that they're able to easily rewatch that video. So our patients are enjoying the ability to educate on their own, and then bring questions after watching these videos to nursing staff. This is empowering them to manage their care and to be an active participant. One of the great things is we recently have been told that this technology, these videos that we're assigning, will then, once the patient's discharged, be incorporated to their discharge information that's available online. So patients that have set up their MyChart accounts, who can access their medical records from home, can also access these videos for future reference. So that's a great addition that just recently we've been offered and found out about. This project has been quite an experience for the student to be able to work with the interprofessional team and develop something that we hope to have a positive impact on patient education and patient outcomes. It's been exciting to see how our unit has embraced a lifelong learning attitude and a concern for patient care. And through my education at Western Governors University, I felt prepared to be able to execute the things that I've learned in the clinical setting. And I hope that this project will demonstrate the abilities that we've been given through this education to better care for patients and improve patient outcomes, as well as lead and develop unit staff to embrace these changes and be proactive in patient care and management. I'd like to extend a special thank you to Tricia Kingery, our senior director, who has been the student's mentor through this Capstone course. I sincerely appreciate all the guidance and knowledge and mentorship that she has brought to the table for the student. I'd also like to thank Julie Wright, our unit director, for leading the oncology unit and helping to inspire our team to embrace change. She's definitely facilitated this unit accepting this project. And I'd also like to thank Dr. Melidi, our medical oncology director. She's been an invaluable resource to collect physician feedback and provide to the student, as well as other members of the interprofessional team. And lastly, but most importantly, I'd like to thank the staff nurses on 10 South Oncology for their dedication to patient care, their dedication to lifelong learning, and their ability to be flexible and adapt to change. Their embracing this project has meant a lot to this student, and I know that together we'll be able to accomplish great things for our patients and our unit. I sincerely appreciate the opportunity, and I thank you for your time. Have a great day.